Hi, my name is Amber and this is my head to toe assessment. I will begin by washing my hands before I enter the patient's room, and then I will provide privacy as I enter the patient's room. Hi, my name is Amber. I'm going to be your student nurse today. Can I see your wristband to verify your name and date of birth?
Yep. Kyle, December 30th, 92.
And your last name?
Rogers.
Thank you. Okay, can you tell me where we are today?
At the hospital.
And can you tell me why we're here?
My annual physical.
Thank you. My patient is alert and oriented times 4, and he is able to respond accurately to my questions. So, before I have you stand up to get your weight, I'm going to get a set of vitals.
Okay.
Are you in any pain today?
No.
On a scale of 0 to 10?
0.
Okay, perfect. And your vitals are within normal limits. So I'll have you stand and walk over to the scale. And as my patient walks over to the scale, I can see that his gait is normal and steady, that he doesn't require the use of a gait belt, walker, crutches, or cane. Do you have any dizziness or lightheadedness when you walk?
No.
Okay, perfect. And your weight is within normal range. Now I'm going to test your balance. If you could step back off the scale and put your feet heel to toe and arms at your side and close your eyes. And I can see that my patient's balance is intact. Now before I have you sit back down, I'm going to have you bend over and touch your toes so I can see the curvature of your spine. And as I palpate down your spine, I'm looking for any curvature, and you do not have any. Your spine is in line with the rest of your body. Go ahead and stand up. At this time, I can also check that his pelvis is in line with the rest of his body. And go ahead and take a big breath for me. And I can tell that his chest is symmetrical when he takes breaths. Okay, go ahead and take a seat. The first thing I'm going to examine is my patient's head. I'm looking for any lesions, bumps, bruises, or infestations in his hair. And I don't feel any bumps. I didn't see any infestations when I combed back his hair. And the next thing I'm going to check is your pinna, which is the outside of your ears, and I'm just feeling for any bumps. At this time, I'll have you turn your head towards me, and I'll take a look inside your ears. For an adult, we pull up and back. And the other one. Up and out. Good. So in your ears, I'm looking for any drainage or swelling. Okay, chin up just a little, and I'm going. Okay, then I'm going to take a look at your eyes. I'm going to start with your conjunctiva. And I notice that your conjunctiva are nice and pink and moist, and my patient's sclera are white. I'm going to shine a bright light in your eye. It may be uncomfortable just for a minute. Go ahead and just look at my nose. Good, and my patient's pupils are round, or equal, round, and reactive to light. I'm going to have you follow the tip of the pen to test your 6 cardinal gazes. Great, so my patient's pupils are equal, round, and reactive to light, and they accommodate for distance. Go ahead and follow the tip of the pen. Perfect. Now the next thing I'm going to check is my patient's face. I can tell that his skin is warm and dry. There are no discolorations. I'm going to look inside your nose and cover your eyes here because it can be a bit bright. And in your nose, I'm looking for any drainage or swelling. And I see none. Now go ahead and open your mouth. And the inside of my patient's mouth and his oral mucosa are pink and moist. And I can tell that his lips, tongue, and gums show no sign of cyanosis. Okay, now I'm going to check your facial nerve. So go ahead and smile, frown, scratch your face, puff your cheeks, and stick out your tongue. And go from left to right. Good. Okay, now we're going to check one more nerve here. Go ahead and shrug against resistance. Perfect. And that was your accessory nerve. Now, the next thing I'm going to check are any lymph nodes and checking for any swelling as I go down my patient's neck. I can see that his neck is symmetrical and that his trachea is in the middle. Checking for lymph nodes. And then I'll have my patient swallow. And I can tell that there is no swelling of the thyroid gland when he swallows. Okay, The next thing I'm going to do is check your pulses. So I'll start with your carotid pulse, and I'll do one side at a time. Just look straight ahead. And each side is strong. I'm also going to listen to your carotid arteries and make sure that there are no bruits. And there are none. Okay, the next pulses that I'm going to check are your brachial pulses. Extend your arms, and those are on the inside of the elbows. And those are both equal and strong. And now your radial pulses. And as I go down his arms, I'm noticing that he has no edema in any of his upper extremities. Good, those are equal. And I'm going to have you extend your legs, and I'm going to check your pedal pulses. Now, as I check his pedal pulses, I can see on his legs that his skin coloration is still good. There's an equal amount of hair distribution. His pedal pulses are equal and strong, and I can check his toes for capillary refill. Okay, perfect. And then I can also check his fingers for any clubbing, which would be a sign of long-term deoxygenation. And I noticed that his capillary refill is good, which is under 3 seconds for each of his fingers. Okay, next thing I'm going to do is take a listen to your heart and lung sounds. I am going to begin by just palpating the area, making sure that there are no masses that I can feel from the top layer. Okay, now I'm going to take a listen. And when I tell you, just go ahead and take a couple deep breaths. Okay, deep breath. Okay, and the other side. Okay, so I don't hear any crackles or wheezing from the front side. I'm going to have you turn as best you can, and we're going to do the exact same thing on the back. So I'll palpate down the area first. And I know where the scapula are at this point, so I don't have to listen, so I don't have to try and listen over them, because I wouldn't be able to hear any lung sounds. Okay, deep breath. Breath. And one more. Good. Your breath sounds are equal on both sides and on the front and back, and I don't hear any crackles or wheezing. The next thing I'm going to listen to are your heart sounds. And when I'm listening for your heart sounds, I'm listening for the lub-dub, which is the S1 and S2 sounds. You can breathe normally. Okay, now I'm going to take your apical pulse, which is your left midclavicular line in the 5th intercostal space. So we find it 5th intercostal space. And his pulse is strong. Okay. Next thing I'm going to do is have you lay flat. Okay, and our bed does not allow us to test for a jugular vein distension, so I'm going to raise you to a 45-degree angle, and when I do, I'm going to have you look towards the window so I can see your jugular vein and see if it has any distension. Okay, here we go. Look towards the window. Good. and his vein, his jugular vein is not pulsing, nor does it get swollen or distended. So I can note that he has no jugular vein distension. Now, before I move on to your abdomen, do you have any pain or swelling in your abdomen that you've noticed?
No.
Okay, do you have regular bowel movements and urination?
Yes.
Okay, so we're going to begin by examining the contour of your abdomen. So I noticed from 2 angles, so 1 and 2, that his abdomen, without the shirt, has a normal curvature. Next thing I'm going to do is listen for active vowel sounds in all 4 quadrants. Okay. Okay, and I note active vowel sounds in all 4 quadrants. The next thing I'm going to do is lightly palpate your abdomen. Please let me know if this causes any pain.
Sure.
Okay. And I note that my patient doesn't have any upper or lower edema while he's lying down. So I'm going to have you sit on the edge of the bed again. We're going to check out your musculoskeletal system. So go ahead and extend your arms, palms up. Go ahead and bend your elbows. Good. Rotate your wrists. Rotate your arms to the side. Okay. Now we're going to check your strength. Make sure it is equal on both sides. Squeeze. Good. My patient's strength is equal. You can also test that by pushing up, push down, and same thing with your feet. Go ahead and extend your legs and pull up. Good. Push down. Good. Okay. And I would wash my hands upon exit, and that is my head to toe physical assessment.